As you know, in our virtual room, normally that is the virtual room we are using to teaching in our school. You know, I don't know if the people who are there know very well the NPR International School. The NPR International School is an international teaching. And we teach in America, in Europe, and in Asia for all different topics. Here is Dr. Sayed. Let me open him. Okay, let me see him. Let me see. Here is. You can open your microphone, Sayed. Yes, and you can stay here in our application. Okay. Yes. Let me see. Here is him now. Yeah. Okay. I see you. You can open your microphone. Yes, Sayed, and we can talk. Yeah.
Yes,
Oh,
Dr. Sdirocca.
we are here now. We solved the
Sorry,
problem. We solved the problem.
yes, a little bit problem with my browser.
Okay. I saw something there. Let me see that you have something there. You can close the sharing. Yes, you say here you are sharing something in your phone. You can stop the sharing. Yeah.
Yeah, I stopped it.
Okay, because I see your. Let me see if I can close here your. No. The camera you can open, but I am seeing something of your mobile phone here. Yeah. I
Now
don't
is
know.
it okay?
No, you put the mobile. Change the position of the mobile because you are like this. Okay, you change it. You move the mobile from the camera. Yes. Okay.
Yes. Now is it okay?
No, and now it's okay, but I don't know where you are because you are in two kinds here. I see you twice. I see you here little. I think I don't know what is that. Let me see. I see you here, and it doesn't matter. All right, it doesn't matter. It doesn't matter. Okay, listen. Okay, we can. The thing is, if it's better if you start. I see your face in that position. I don't know why. I don't know why. I see you. You are sharing your mobile application. And I see your mobile application in the camera, Sayed. Okay, you have to check it. Yeah.
Just a second, I will just check.
Check it because it's three. Yes, I see here your mobile, but I don't know why. I don't know. I see your mobile phone. You see that? You see your mobile phone? Yeah. I don't know why. What happened there? I don't know what you're doing with the mobile. Check it. That's it. That's gone. That's gone.
Now,
Okay.
okay.
And then move your phone like this, and you will be no, no the other way.
I got it.
With the head down now. With the head down the other way.
Now is it okay?
No. It's down. You have to move the whole phone, and you will be. That's okay. Now you are with the head in the right place now.
I'm extremely sorry. I was a little bit engaged myself. I was trying to get onto the session. So I'm absolutely sorry for this.
No problem. You know, when we're doing something live, that's happened. Okay, if we can record there, it doesn't matter. But we are live, these things happen. Okay, we are okay now. We start recording the meeting, and we will start now. Okay, we say hello for the people who are here. Yes. Today, I will introduce a little bit the topic of the webinar. Okay, and then we will do. We will start to talk. Okay, all right. Okay.
Sorry to interrupt you. Can I know that people are already joined or some are?
There is Amit, there is Dinya, there is Nabil. It's three people. They will come, I think, because sometimes they take a little time. These people for India here.
Yep.
They can. There's three people. But as I told them, the lecture is recorded, and then the people who is registered into the app is 34 people registered. They will receive the recorder when the lecture is finished, okay? And they can listen anytime. And we will share also this recorder in all our social, all right? That is the normal way we do in our school, okay? Let me present our school and the topic of the meeting today, yes, for the people who will listen here and later. As the people who don't know the NPR International School, it is an school who teach all around the world. We teach in America, in Asia, in Europe, for all medical sciences, for medical doctors, for physiotherapists, dentists, osteopaths, all medical science, they are into our school. And this application that's why I recommend the people to register in the application, because it's a lot of free material in the application. Obviously, we have the courses in our application. The people learn with us in this web app. That is the app of the academy. Yeah? There is free material and there is courses. And it will be the course we will talking today in the future. The topic is the Master of Postural Osteopathy. And we will develop that today because Professor Sayed will develop in Kashmir the side of our school in his clinic. We collaborate with him for a lot of years, and we will start now in India to teach also in Kashmir for India people, for the people who are in the area. This will be the side of Kashmir of our school, of our academy there. Okay, and Professor Sayed is the director of the area, and he will deal with all the things regarding our school there. But the topic I will talk about the topic of today. What you say, Sayed? Okay, we're talking about the master. All right? Yeah.
Yes, Dr. Sdirocca, it's better that you please introduce the things, and then simultaneously I will also add up something. But better you introduce to the main subject.
Okay. I will introduce that, and then I will do some questions, and we will talk as a normal webinar. We normally do in our webinars. We don't prepare the webinars. I don't believe it. If I record something, I prepare it, but I prefer spontaneous webinar. It's better. It's coming better. I have 50 years in medical sciences and 20 years teaching in online. It's a long time. I were one of the first that started teaching 20 years ago when the technology was not like today. The technology was different, okay? But now it's easy. Now it's very, very easy. Now we can arrive everywhere for everybody. We can teach online. And that I will tell you what is the topic. Topic is a new master. We, in our school, in our academy, we do different formations. Masters, we have courses, we have a master class, and we have little topics. We have for the shortly, medium, and long-term study. This master is for long-term. It will be a master for become specialist in manual therapy, in osteopathic therapy. But what is the difference? Because it's a lot of masters of osteopathy around the world. And I want to tell you what will be the difference, because that is different. That's why I call it postural osteopathy. That is not only manipulation, that is not only to treat the patient, just to see the patient in another way. When you understand posturology and posturometry, that means the whole body, your treatment is better. And I can tell you my experience of 40 years teaching that all around the world, posturology and posturometry. I started teaching about in 1986. It's a long time, a very, very long time. And I believe that we cannot work only about techniques. Obviously, in the master, you learn techniques. Techniques is a tool. Without tools, you cannot work. But the best thing is understand for what is useful this tool. That is important. You will have a lot of tools, but the main thing in that master is osteopathy and posture. Because sometimes we look the patients in our side, if you're a dentist, you see your side. If you physio, you see your side. If you are an osteopath, you see your side. If you are a doctor, you see your side, the point of view, and that's no good in my opinion. That's why I invent the NPR protocol. NPR sciences is that, to see the patient with the same point of view. You will have a protocol in posturology and in posturometry to plan the treatment and obviously to do the treatment. And when you do that, believe me, the treatment is easy because you go directly to the point. Sometimes the techniques fail because we don't see the whole body. We want to apply. Imagine, I'll give you some sample. Sayed know very well that craniofacial system. Craniofacial system is a disturber of the posture. And you cannot do a good rehabilitation if you don't treat in a good way the craniofacial system. At the reverse, a dentist cannot do a good rehabilitation, local rehabilitation, if you physio don't do a good physical rehabilitation. That's the point. That's the shock, because everyone wants to treat, separate the patient, and that's not possible. Believe me, that is not possible at all. Okay, that's the introduction, and now I will give. I will tell you some questions, Sayed, and you talk with me regarding that. Okay, the first one, I prepared a little scale just to be more organized. Okay, and the first one, we will talk the both regarding this topic. Okay, what is, in your opinion, postural osteopathy, and how does it differ from other
Yes,
branches of osteopathy?
as
You can talk about
Professor
that, and I will
Dr.
talk later. All
Sdirocca
right,
has
that's the word for you.
well
Okay.
elaborated the things in size and very epigrammatical style. You have defined each and everything in a good way. Uh, as you have said, Professor, that we have to look everything as a whole, not in a segmental way. So our thought, like Professor has developed this MPR science, is really a wonder for this age, because especially those who are rehabilitation therapists or the dentists, and it has brought medical faculty or medical science under one roof. As we can see that osteopathy was confined only to the bones, to the joints, and to the ligaments and correction of the spine and all. But the main work what Professor has done, the great thing that he has combined posture and the osteopathy as a whole. And it's not only going to serve the osteopaths only, but it's going to serve everybody, whether it is a doctor, whether it is a dentist, whether it is a physiotherapist or osteopath, or anyone who is working on rehabilitation system. The thing is that not only, as we know that the human has acquired some of the problems because of the posture. Bad posture has attributed to the long aching pains, different things like if we take a body as a in a segmental way, then we will talk about the cervical pain, the lumbar pain, and nowadays because of the mobile we have the text neck and other deformities they have occurred because of the posture. And now to correct the posture, we have to combine the rehabilitation system. And sometimes when we deal with the MPR science, it teaches us how the body is linked with each other. For example, if there is any jaw alignment is not correct, it attributes to the neck pain, while as the orthopedician or the physiotherapist is treating the neck, but he is somewhere missing the jaw point. So the thing is that combining each and everything, studying the posture, studying the osteopathy, studying body as a whole, will definitely lead us to a comprehensive and a compact rehabilitation advice for the patient. And at the end of the day, the patient has to be assessed. And for this assessment, we have introduced so many good things within the MPR science, within the this master's program. We have the posturometer to check the posture. We have the BED devices, body equilibrium devices, and many other things. We have combinedly associated each and everything and combined in such a way that it really meets to the protocol of rehabilitation. And we have also introduced integrated vibration science within this program. I hope I am to the point, Dr. Sdirocca.
Yes, yes, you do. You do drill the point, and I want to add some little things on it. That when we're talking in interdisciplinary way, the interdisciplinary way is treat the patient with different specialities. Yes, the main thing is to speak the same language in diagnosis and therapy. Because if it's not, everybody will give the what I explained, that the point of view of the treatment, and that's not good. When we see the patient in the same way, in the same point of view, we can plan the treatment in the same point of view, and we can work together. If it's not, we are doing just a derivation of the patient. I send you the patient, you do your job. You send me the patient, do my job, but we don't communicate. To communicate, we have absolutely to speak the same language. And I think the first question was good. And I go into the second question. Okay, all right. What specific topic I will tell the other specialists, but you will cover
Yes,
in the master.
doctor.
Explain the people what you will teach in our master.
I will be
Okay?
taking the topic of integrated vibration science. And in that and integrated vibration science, we will be talking about the effects of vibration therapy and how we are connected. Our body is connected within, and how we are connected to each other, how we are connected to the entire universe, how we are connected to the Mother Earth, to the sun, and how we are interlinked with each other. And then we will be talking about the different aspects of vibration gadgets what we will be having within our program. Like for example, if we talk about the whole body vibration therapy, we'll be talking about the latest Z vibes for oral rehabilitation therapy, and many other topics will be covering within our MPR science program, especially this Masters in Postural Osteopathy.
All right, that's interesting because it's a very, very important topics that we will learn, the people will learn into the mass. The other things we will learn: craniofacial therapy, craniosacral therapy. We will do all the abdominal therapy. We will do all manipulation from the top to the bottom. And we will study tissues, and the main thing the people will study. Guide for me the craniofacial system, because an osteopath who don't know craniofacial system cannot work together with the other discipline as a dentist, for example. They will learn how to use the whole manipulation, but the main thing at the beginning of the master, they will be introducing into the posturology and posturometry. Why posturology and posturometry? Because it's a postural osteopathy. They will be introducing the diagnosis of the whole body, but mainly in the posturometrical diagnosis. An instrument that you will see during the master is a fantastic instrument that helps a lot in rehabilitation, in diagnosis, projection of the treatment, and also follow our treatment. That is fantastic. But also osteopaths will study how to use the bed device, the body equilibrium device. That is a device for everybody. Every medical science can, with that device, annulate the craniofacial system. That is a device that I invented 25 years ago for all medical science, because when you annulate the craniofacial system, the rehabilitation goes straight and easy. You will learn manipulation, you will learn diagnosis, you will learn a lot of things in this master. That is the difference, all right? And another question, we go ahead with the question. Tell me, what do you think? I tell you later what I think. Which science can be in this master? Tell
Doctor,
me, in your
as
opinion,
of me,
who
what I
can
think
learn
that
osteopathy?
this is not confined to a particular one group of medical faculty. It can be a dentist, a medical officer, a medicine doctor, a physiotherapist, an occupational therapist, an osteopath, any of them who are within the rehabilitation team can learn this science and they can go for this master's program. And I have one more question on it, doctor. Some people may ask, like, how many years this program is?
Yep. Yeah, I will tell you that immediately. That not only that, I will tell you the certification of the program, because that is important. The certification they will have. I will explain how the master will be. I think that is important. Okay. As you told before, that will be for medical doctors, for dentists, for physiotherapists, and for osteopaths also that want to change the mentality and understand a new point of view in that way. The master is 2 years formation. We have 2 years program master. The new thing is we have all online. The whole theory will be online, some practice will be online, and some practice will be in place, right? One practical in place a year for a week, 1 week, 1 year, 1 week the next year, they will practice with us. Practice can be in India, in your school, we have some practice, and practice can be in Spain. The people can move to Spain, to a very good places in Spain to do the practice with our teachers. The master program is dedicated to have in our application. That's why I want to introduce the application, because in the application will be the whole master, the whole theory, the whole material, the whole recorders lectures will be there, that the people can learn anytime when they want at home with PC, with a tablet, or with the mobile phone. And that is a very good thing, because you can take in your hands the lectures everywhere and in your free time. When we do the lectures, obviously, you will have a planning to learn the lectures. Any lecture will open for a time You have to complete the lectures. When you complete the lectures, you have direct talk with the teachers. We have a Calendly option. Then you can book a topic. You can book an appointment to clarify doubts. And they will be one live a month to talk together, to explain something in direct. That is a mixed format. It is recorder, materials in the web. You can contact us to make an appointment to clarify directly, person by person, the doubts, and once a month, a direct live workshop like this. We are here, direct live workshop with the professor who did the lectures to clarify the lecture with you. Some practice we can do, some practice we will keep online to study, and then practice when the people is in place, right? And that is very important because when you arrive to the practice, you know everything. I have a lot of experience in teaching, and that's why I start to change my mentality to do theory online, because when the people arrive to the practice, they concentrate in the practice. Because if it's not, the brain is confused. When you are in the practice, what is the theory? I forget it. And no, you will learn everything and you will be ready for the practice. That's why 1 week is enough, because you will learn everything. And our master will have 3 certifications. One certification, obviously, is for our academy, the NPR International Academy. The second certification is for the R.M.P Swiss, is the Interdisciplinary Association of Posturology from Swiss. It's an association that I am the vice president of the association, and Dr. Sandra Schultz is a physician, specialist in rehabilitation, is the president. The second certification is for this. And the third certification is for the Y University. It's the International University and Open University from Argentina that give the university certification. We have 3 certificates in one master, and that is very good. And I think I told everything. I think I told everything you asked me. Yes. If you want some more information, tell me. I will.
Regarding the fee structure, they can.
Do you think it's clear that? Yes.
Yeah, sorry. For
we close the microphone
structure
here. You can open the
they
microphone.
Can write to the academy and they will
microphone and. Yes. They can write to academy. They will have the program. If they write to me, to the academy, they will have the program and also the fees. Yes. They pay monthly. The fees. We can divide in statement, not monthly.
Absolutely.
I think it's 2 or 3 statements. The whole fees of the master. Okay.
Yes.
And they can write to us, and they can have all this information. Yes, it is. You have got the camera. Can you open the camera?
That's enough for today.
The camera is gone.
And we will be soon coming
do you
with
want any more
second session
information
of
for
our
the people
talk,
here, or that's enough?
so that they will if there is any clarification or anyone wants to ask any question, they can write down in the questionnaires. They can ask the question, or they can raise their hand and ask the questions for us.
Yeah. And then also they can, if they want, I have more questions. We carry on with the webinar still, but they can write if the people see in any live workshop, there is a forum of discussions. If they go there, the people who are registered in this webinar, this is an open forum. They can write different things there, and I will answer directly to them. Yes, there is a forum discussion that is important for that. Okay, and let me ask you something now. Okay. Tell you are a physiotherapist, all right? Okay, and tell I will tell you my
Yes.
opinion. You tell your opinion.
Yes.
Why?
According to my point of
for
view,
physiotherapists
as being
do
the
this
physiotherapist, and why a
because we're talking
physiotherapist needs to
special
do this,
for a physiotherapist and your point
especially
of view,
which is
okay?
related to the postural osteopathy. The most important thing is that we physios are always giving our clients an advice, an ergonomic advice for posture correction at home, or we usually go to the corporate sectors for giving a lecture to them how to be on the system and how to maintain the posture on the system and all. And there are so many issues with us, like some people coming with the low backache because of the postural instability and all. So as a physiotherapist, we have some gadgets, latest invented gadgets by Dr. Professor sdirocca, that mostly the posturometer and the BED, body equilibrium device, which will definitely add to our gadgets and which will add to our skills. And being when we complete this masters in postural osteopathy, we can introduce the integrated vibration science into our practice as well, and osteopathy as well. So it's a combination of the variety of programs which will be adding to our skills and to our clinics, and this will really help us to diagnose, to assess, firstly the assessing the patient, then diagnosing the patient, and then planning his treatment protocol. This is what I think.
Okay, that is important. I believe that is very important because the physiotherapists we came to, I think the medical way treating the
Yes,
whole
yes, doctor.
body integrated. Okay, that is the very important thing. All right. Okay, let me ask you another question before we finish the the academy. Tell me about something about your
Yes,
clinic in
I'm
Kashmir,
running a
how you
physiotherapy
collaborate
studio
with us
in
in the
Kashmir.
NPR, yes,
It's
and then we will finish the webinar from today.
under
If
the
it's
name
no
of
question, we will
Waris
finish.
International
Okay.
Home of Balance. We call it wihob.in, WIHOB.in. And I have associated with NPR Science long back when we met Dr. Professor sdirocca during the one of the lecture one of the conference in neuro conference in New Delhi. And after that, I invited professor to visit to Oman, and he had rehabilitated one of my patients in a good way. And there we started talking about the science to be developed in Asia, and then we started working for that in Kashmir. And now, as the master's program has been started, so our center will be the mostly the practical sessions will be at my center in Kashmir. And we have all kind of gadgets over there, rehabilitation gadgets, including the bed, and we'll be soon having the posturometer over there. And also we'll be having the vibration science gadgets along with it.
Okay, that is a good thing because we know with this collaboration we can open a lot of things in the north of India, in the area out there. Okay, and the people from India can go there and they don't need to. They can move, obviously, if you
Yes.
want to Spain, but also they can stay. They can stay there. They can
Yeah.
do a mix, one in India, one in Europe. Okay, okay. I think that will be enough for today. Yes, enough information for the people. And as I told you before, in you will receive the people who be registered. The 34 people who were registered in our live workshop, they will receive the recorder and they can listen. And I will then also I will put to them the emails where they can write to you also directly and to our school, our academy directly. We will put the emails. I will put here, and they want, and you can write also your email here if you want. I can put here. This is the company. If you give me your email, I will, where you want they write, I will put in here. Yes, this is the email for Silverstone. Yes, Silverstone is one of them. If you send me, I think you can write in the chat your email. Yes, you can write the email and they can contact you or the company. And also I will write my personal email. Yes, if they want some information for me, they can go and write to you, and they can write to me or to the company who is Silverstone, who deal with this master. Okay, I think we say everything we need to know. Yes, and we will do another webinar explain more things in the future. Yes, we will be organizing another one. Yes, just to speak for some specific topic, And I invite the people also because in our application, is they register there, they will have a lot of free information there. And that webinar will be also in the free information, also in our web app, right? They can share that.
Thank you for invitation. And it's a great initiative for this program to be launched very soon.
Okay, thank you so much for everybody to be here, and you say yes for your time. Okay, the master start in October. That is the last thing I want to say. The master start in the month of October. In October will be the first lectures. Be ready because we are collecting the people, the people who will be in the first edition of this master. Okay. Thank you so much, Sayer. Thank you for everybody.
Bye-bye, doctor.
And I will see you in the future. We in touch, and you will receive also the recorder of the lecture, and you can share for your people also. Bye-bye, everybody. See you next, and have a nice time. Bye-bye.